Welcome to my channel Health for You.
Don't forget to subscribe my YouTube channel by pressing a subscribe button below. Itching during pregnancy causes and treatments. When you are pregnant, you treated all waters with extreme caution. Anything even minorly deviant from your normal body functioning can cause the alarms to start bouldering in your head. We can imagine the stress you must be going through when you start to experience severe itching, not to forget the irritation from the sensation. If you are on the lookout for safe and effective home remedies for this, you have landed on the right video. Itching is a common problem during pregnancy, but it is definitely non-untreatable. There are a number of home remedies that can cure this condition. What causes itchy skin during pregnancy? The most common causes of itching during pregnancy are weight gain and hormonal changes. The gain in weight can stretch your skin and reduce its hydration, while the hormonal changes can wreak havoc internally, which reflects on the surface on your skin. There are also other not so common causes for this itchiness during pregnancy. These are given below. Pituitary urticaria, papules, and plaques of pregnancy. This is a condition that is also commonly known as PUPPP. It is a skin rash that is similar to hives, and it usually appears on the belly of pregnant women. PUPPP usually develops during the third trimester and is more common among women who are pregnant for the first time or those who are pregnant with twins. This condition does not pose a threat to the mother or a baby. However, it can cause a lot of discomfort. Cholestasis. This is a condition in which pregnant women develop liver problems. The normal flow of bile throughout the body is affected. With cholestasis, pregnant women experience severe itchiness all over their body but without any visible rashes. This condition poses a threat to the unborn baby and needs to be treated immediately. Yeast infection. Some women experience itchiness or irritation in the vagina. This is caused by a yeast infection in the genital area. Hormonal imbalances or a poor diet with excess carbohydrates and sugar can cause fungal growth. Doctors prescribe pregnancy safe antibiotics to women who develop this infection while they are pregnant. Prurigo of pregnancy. This is a condition that usually occurs during the late part of the second or early stage of the third trimester of pregnancy. It starts out as spots that appear similar to bug bites, can turn into tiny cuts that crust due to scratching. This is a rare condition. This is a rare condition that can cause itchiness that affects the torso or limbs. Antihistamines and topical medication are usually prescribed to treat this condition. In rare cases, oral steroids may be required to treat it. The condition does not pose any threat to babies or their mothers, and it usually disappears after birth. However, in some cases, it can last up to 3 months after childbirth. Pemphigoid gastritis. This is a very rare condition in which pregnant women develop eruptions that are highly itchy. They begin like hives and slowly turn into blistering lesions that are large. This condition usually occurs during the second or third trimester. However, it can begin at any given time, including 1 or 2 weeks after delivery. The eruptions start appearing around the belly button area and spread to the other parts of the body, including the soles and palms. Oral steroids are the most common medication used to treat the condition. It has risks such as growth problems for the fetus, premature birth, or stillborn babies, which is why it is imperative for pregnant women to get treated immediately if the condition is diagnosed. Close monitoring of pregnancy is also a must. Impetigo herpetiformis. This is a condition that rarely occurs. It is a form of psoriasis that develops while a woman is pregnant. Although it can start earlier, this condition normally develops during the third trimester. It causes extensive areas in the body to redden with small rashes filled with pus. These rashes may turn into large pus-filled areas that turn white. The rashes appear on the groin area, thighs, armpits, under the breast, around the navel, etc. They can cause pain but are itchy only in a few cases. This condition causes vomiting, fever, chills, and diarrhea. Pregnant women and their unborn babies are closely monitored if they develop this condition, as there can be complications. Systemic corticosteroids are used to treat it. In some cases, depending on the condition, patients may be prescribed other medications. It disappears after delivery. It disappears after delivery but can occur again during another pregnancy. Don't forget to subscribe my YouTube channel by pressing a subscribe button below.